phases before menopause. In your late 30s, your egg supply begins to decline in number and quality. As a result, your hormone production changes. You may notice a shortened menstrual cycle and some PMS symptoms that you didn't have before. From there, you begin perimenopause. Gradually, your periods become irregular. This can start as early as your late 30s or as late as your early 50s. It can continue for 2 to 8 years before menstrual cycles cease. During this time, your ovaries are sometimes producing too much estrogen and/or progesterone, and at other times too little. Your progesterone is likely to fluctuate more than before. This can lead to heavy menstrual bleeding. About 6 months to a year before your periods stop, your estrogen starts to drop. When it drops past a certain point, your menstrual cycles stop. After a year of no menstrual periods, you are said to have reached menopause. During this time, hot flashes, irritability, along with other symptoms may become prevalent. From there, you enter postmenopause. During the next year or so, estrogen levels keep going down. This lowers your risk for certain types of cancers because estrogen is linked to some types of cancerous cell growth. However, low estrogen also creates some health concerns, such as bone loss. Low estrogen levels after menopause speed bone loss, increasing your risk of osteoporosis. Skin changes. Low estrogen leads to low collagen, which is a building block of skin and connective tissue. It's normal to have thinner, drier, wrinkled skin after menopause. The vaginal lining and the lower urinary tract also thin and weaken. This condition can make sexual activity difficult. It can also increase the risk of vaginal and urinary tract infections. Tooth and gum changes. Low estrogen affects connective tissue, which increases your risk of tooth loss and possibly gum disease. Although the reasons aren't well understood, a woman's risk of heart disease increases after menopause. Additionally, night sweats, vaginal dryness, bladder infections, depression, and a host of other symptoms may be realized during postmenopause. Hi, I'm Ann Malkmus, and I'm in menopause. My case is likely considered a textbook case. I started out with irregular cycles and heavy bleeding in my late 40s. I just didn't understand what was happening to me. I had been recently married, and this is not what we signed up for. I actually was panicking because I had been so regular and normal, and how could this be happening to me? After all, I was a clean eater. After the loss of our teenage son, I found myself in a situation where I didn't know whether I was grieving or experiencing the symptoms of menopause, or both. One day I was smiling and could hold a pleasant conversation. The very next day I awoke in a cloud of depression, but didn't know or identify it as that. I just knew I wasn't happy with anyone or anything. My poor husband had no idea he had married a Jekyll and a Hyde. So I had a hormone test, which identified I had very few of any of the 3 primary hormones left. Those would be estrogen, progesterone, and testosterone. I had been a healthy plant-based eater for many years, but soon realized that with high levels of stress, any woman can experience severe menopausal symptoms. Diet is key to improved female health. Sugar, even from fruits, has been known to be a catalyst for hot flashes and irritability. Caffeine, meat, and dairy can cause swelling of the breasts. With discreet supplementation and a healthy, mostly plant-based diet that consists of eating many living vegetables and greens, you can soar through this season with little or no concern for those looming health issues that affect many women at this stage in their life. Luminology is that supplement that's taken with a healthy diet and moderate exercise will help you through those trying times. Click below this video to find a free grocery list to help you regain control of your health today. Luminology is the expert in the science of her.